The main reason it's such a concern is we don't know the cause yet, and that's unsettling. But I think parents need to remember that this is exceedingly rare. And there's a systematic process underway right now to try to find out the root cause of this. So one of the theories is, perhaps kids were not as exposed to viruses during the pandemic. So now we're seeing an exceptionally large number of cases causing a very rare complication to present itself more often. So that's one theory, but there's other theories as well. Like perhaps this is a post-infectious inflammatory syndrome, maybe perhaps driven by COVID-19 infection itself, or by adenovirus, which is a very common group of viruses that cause, the common cold or a flu-like illness. So that's another theory, or perhaps it's the combination of both. One thought is perhaps it's an abnormal response to the adenovirus due to perhaps prior COVID-19 infection. When this first hit the media, the most common thing that I saw, unfortunately, was, see, we told you this is the vaccine. This is why we shouldn't be giving the vaccine to kids. So first of all, what I want to say is the vast majority of the children who have this unknown type of hepatitis are under the age of 6. So those kids are not yet eligible for the vaccine. So this is, most likely not a vaccine-related injury. It's essentially off the table when you think about that most of these kids were not vaccinated. But I think, when you go online and you see these theories, it evokes fear. And then it's at the back of your mind and you start following things online. And I think we just need to really be careful about that. And what I would say to parents right now, just to be aware of some of the signs and symptoms in your kids to watch out for. I think that's really important. So specifically, if your child has abdominal pain, so stomach pain, or has yellowing of the skin or the whites of the eye, that's known as jaundice, pale stool, or very dark urine, you should speak to your healthcare provider because it's actually a very simple test that we can do to see if there's inflammation of the liver. It's a blood test. And other things like nausea, vomiting, and diarrhea are other symptoms that you could have with inflammation of the liver. That being said, there's so much gastroenteritis going around. So many kids are sick with other things. So if that does happen to your kid, I wouldn't, suggest panicking and worrying that this is what they have. But I do think it's important that you speak to your healthcare provider and have them be assessed, and so that we can rule out anything serious. And again, that would be with a simple blood test if necessary.